Hi, ladies, how are you? I just want to talk about a virus that some women don't know about, and it's called the HPV virus. That virus can cause any cancer in the body because it's a virus. Well, on the 4th of October of this year, I was diagnosed with cervical cancer early stage, and I thought all my life, well, not all my life, but when I first got the injection, when they first brought it out in the schools, that I was covered. But they didn't tell you you're only covered for 4 strains, that you need to go back and get another injection. So now I'd been diagnosed with cervical cancer early stage. I'm doing treatment, and that's brutal. I'm tired, my body burns. I just don't want to leave my house, I don't want to leave my bed. My hair was blonde before this, but I dyed it black, so you can't see where it's been falling out and where it's thinning. If you had your injections at high school, go to the doctor and get checked to make sure you don't have that virus. For years, my pap smears were coming back clear, but this one come back that I had HPV. And I said to the doctor, "What is that?" And she goes, "It's a virus that can turn into cancer. Doesn't matter whereabouts in the body." So I went for an ultrasound, and they confirmed, yes, it's just the start of early stages of cervical cancer. So I'd done 2 treatments of chemo, and something just didn't feel right. So I went back to the doctors because I was having unusual bleeding, and she sent for not another ultrasound, which showed that it had spread up the cervix. And that I have to go in for an emergency surgery to get rid of the cancerous cells. And then I'll need to come in every 3 weeks to make sure that I do not have any more cells, that it's gone. But then I have to do a pap smear every year to make sure it hasn't come back. I've got 2 girls, and the injection now covers for all 9 strains. So if you have a daughter, ask the doctor if it protects them from all 9 strains of the HPV virus instead of 4. Because you don't want to see your child go through chemotherapy or maybe even radiotherapy. It doesn't have to be hereditary. It doesn't have to. Cancer doesn't have to run through the family. Just this virus, the HPV virus, can cause it in anyone, males in their throat, genitals, throughout the body. Females, breast cancer, ovary cancer, uterus cancer, and cervical cancer. So this virus, the HPV virus, is very dangerous. So make sure you get checked. And make sure you ask the doctor if you are protected for all 9 strains. If they say you are only protected for 4 strains, get a top up. Get a top up. And if you got girls, as I said, make sure it covers all 9 strains because you don't want them to go through pain and hell. There was no signs at all indicating that I had it. So please, ladies, doesn't matter how old you are, get yourself checked for the HPV virus. Or even ask your doctor if you are covered for all 9 strains. For some of you, you'll end up getting it. And then it's going to turn into, if you don't get onto it quick enough, it can turn into cancer. Good luck. And I hope that no one else has to end up with this virus if they know more about it. If only doctors told you about it when you went to get your injections and how much it covers you. Because now, if I didn't ask, if I'd just asked, I wouldn't be where I am now. Doing chemotherapy and then going in for surgery. Have a good night. And please be more aware and have all the right information from your doctor to prevent you from this, because I never did, and most women never that has cervical cancer didn't get the chance to have any of this information. Good luck.